Hello and welcome back. My name is Pete Smith. I'm a clinical neurologist at Davies Veterinary Specialists, and I'm going to talk about a little bit more about Olly, the dog that we saw relatively recently who presented with tetanus. And having talked about the way the toxin acts and why it produces the clinical signs that it does, I think what we'll try and touch on today is more specifically on the sort of clinical signs that it tends to result in and how we go about approaching the case in the initial stages. So the initial clinical signs that owners report tend to be rather variable, but the most obvious ones that you tend to see and the most strongly indicative one of tetanus is the abnormal facial expression. And that arises, all the clinical signs in tetanus tend to arise through overactivity of most commonly of the motor neurons in the spinal cord, but also in the brain stem, so affecting the facial musculature and the limb musculature. And I think, as I said the other day, you often see the abnormal facial expression relatively early in the disease because the nerves there are relatively short, and so the tetanus spasmin can have its impact on the nervous system much sooner than it can have an impact on the limb muscles. Though dogs can often walk, and they don't necessarily look particularly stiff in the early stages, but they can still have the abnormal facial expression. So the sort of abnormal facial expression that you tend to see are that the eyes tend to look, you have a narrowed palpebral fissure, so the eyes look slightly slitty. The ears are often pulled up together onto the dorsal part of the head, so that the forehead looks rather wrinkled, and the ears will often stand up quite erect. And because you get spasm in the muscles surrounding the mouth, the orbicularis oris, the lips tend to get pulled into what's often called a risus sardonicus, a sardonic grin. The limb muscle rigidity you will often appreciate at exactly the same time. So it's not always obvious that the facial expression changes, the facial abnormalities develop first, but you will see the legs starting to stiffen up pretty soon as well. When you do a neurological examination on these dogs, you don't necessarily detect any clear abnormalities. So it can make it actually quite a hard disease to spot, particularly in these early stages, unless you've seen it before. But you do get a gradual increase in muscle tone, and that tends to progress over the first few days of the condition. And you can appreciate it most easily simply by watching the dogs walk, and they remain able to walk in those early stages, but the limbs are very stiff, and so they can't bend the joints very much. But the most obvious clinical signs that you tend to see are of an altered facial expression. In some cases, you will get regurgitation or perhaps even vomiting. And actually, in Olly's case, this was one of the first problems that was reported for him. It's not necessarily a particularly common thing. It won't happen in every dog, but it is an important component of the condition because it illustrates the fact that you actually do get autonomic dysfunction in tetanus as well as dysfunction of the skeletal muscles. So the condition almost invariably progresses once the clinical signs have been identified. That tends to occur even though you will start treating these dogs with muscle relaxants. And it probably reflects the fact that you already have a significant amount of tetanus toxin within the body and within the nerves that is currently moving towards the central nervous system. So it hasn't got to its site of action yet, but it's at a site where you can't do anything about it. So you'll often see the clinical signs progressing, certainly for those first few days. Relatively easy condition to spot, but in the early stages, if you haven't seen it very much before, it can be difficult to identify. So once you have made that diagnosis, and it's a clinical diagnosis, you're not relying on any diagnostic tests here, you're relying on your clinical examination and often on the history. Now the history is likely to include something which has enabled the tetanus organism to get access to the body, so a wound somewhere, typically a deep wound where it's likely to be poorly oxygenated. But you don't find a wound in every case. And in some cases you can have tetanus that will occur sometime after having had a surgical procedure done. So don't always rely on the fact that there's going to be a wound there. If you have a dog that looks like it has the clinical signs of tetanus, it's probably worth talking to someone about it and starting to treat it anyway. However, in the majority of cases, you're going to find a wound. And you need to have if it's not an obvious one, you need to have a very thorough search for it. They can be fairly obvious in some cases, so they can be an abscess or a nail bed infection, for example. But as I've said previously, you can get post-surgical tetanus in a significant number of cases. In Olly's case, there was evidence of an infection of a nail one of his nail bases, and he had a slightly enlarged popliteal lymph node in the affected leg. Now, it wasn't a particularly big wound. You wouldn't normally consider it to be a serious lesion, but it illustrates the point that if you get the organism into a deep wound where there's a relatively anaerobic environment, then it could, even if it's a relatively minor looking infection at the time, it can still end up causing tetanus. Now the owners, when you question them a little bit further, the owners of Olly remember that he had been limping on this leg for a few days, about 10 days beforehand. So we don't know for sure that this is the cause of the problem, but given that time scale of about 10 days previously having an infection there and having an enlarged popliteal lymph node in this leg, that seems a pretty plausible source of the tetanus in this particular case. So once you've identified a wound, your priority should be to make sure that you clean it up as much as possible. You want to get rid of all the necrotic tissue and just use appropriate topical dressings, and also use systemic antibiotics, because you have to make the assumption that you have a Clostridium infection there. If there's a recent history of surgery, perhaps the dog's been spayed fairly recently, and that's not unheard of that dogs will develop tetanus after having been spayed. You need to contemplate the possibility of there being an infectious process internally, so perhaps undertake an ultrasound scan of the abdomen as well. Once you've treated the wound, you need to focus on giving them systemic antibiotics as well. There's a wide variety of different antibiotics that you can use. The ones that tend to be recommended are penicillin G, which is benzyl penicillin, and metronidazole. There's a relatively small and fairly old study in human patients carried out which showed that metronidazole had a slightly better outcome. Those treated with metronidazole had a slightly better outcome than those treated with the penicillin. So that would be my choice of what to go for. If you don't have access to either of those, then you can go for drugs like doxycycline or clindamycin, or even amoxicillin in some cases. But the better one to go for, probably, which most people in practice will have access to, is metronidazole. So another important factor in dealing with a dog with tetanus when you first presented with it is what you want to do is as well as that initial wound management, you want to try and stop the condition getting worse. And one of the important things that we should do with this is to provide antitoxin. So as you probably know, antitoxin is a solution of immunoglobulins, antibodies, which are directed against the tetanus toxin. And by injecting them, what we do is we're mopping up any of the toxin that's still floating about in the circulation before it's been absorbed into the nervous system. And so we're trying to stop any more of it getting to the site of its action in the spinal cord and brainstem. It's a good idea with tetanus antitoxin to just do a test injection before you administer the whole dose. So what we would typically do is just use a relatively small volume, inject it subcutaneously, and then have a check of that 15 or 20 minutes later to make sure that there's not been a reaction, because you can get hypersensitivity reactions to antitoxin. It's not common, but it's worth doing. It's a relatively simple thing to do, and you're not really likely to create a life or death situation by delaying for that 15 or 20 minutes. It's probably more important if you've had a dog that happens to have had it before, although it would be rather unlucky to have had tetanus antitoxin previously, because it's quite unusual to get the condition twice. So that finishes off what we were going to talk about today. If you'd like to tune in on Friday, then we're going to cover some more aspects of the treatment of dogs with tetanus and how we go about managing them medically and from a nursing perspective as well. So tune in on Friday to find out about that.